Dr. Sampurna Ghosh. I'm consultant ENT surgeon practicing in Hyderabad, high-tech city. So I'm using this MI1 system for my OPD since couple of months, and the reason of selecting this and liking this when I saw this first is definitely its design. And I have used many other cameras before. Obviously those are all separate units, like camera comes with a light cable which you have to attach with the endoscope, and the monitor is different. So ultimately it becomes little cumbersome and you need a nursing staff or assistant to set up everything before you do the endoscopy. Whereas this system, it absolutely looks like a toy. You can hold it like a gun, and its weight is less than 1 kg. It's 850 gram weight. This is a very compact unit wherein the camera, light source, everything is inbuilt with the endoscope attached to it, and you can change it easily. This one is what I use for otology and rhinology, which is a 2.7 mm diameter scope, very useful for kids as well. And when I want to check larynx, this is the scope for the larynx, which is 70 degree with a 4 mm diameter. So it's very easy to change this, and this is the charging unit. So it's wonderful that you just, in between patients, you just keep it on this and it gets recharged. So what advantage I have felt using this? Number one, I'm quite free and I feel I don't need much assistance all the time, which I used to need with the other camera system before. And because of the less weight and this being wireless, your maneuverability is easy. It gives you more freedom and dexterity when you are doing the endoscopy. No unnecessary wear, pulling and adjusting things, that's not needed. While doing the endoscopy, real time, when the endoscope is in the nose or ear, you can just press this button for the autofocus, which otherwise we had to rotate and need a little more time. That time is saved with this, and the light intensity is perfect. And also there are some advantage of setting different modes according to your level of clarity or what kind of color contrast you want. So I have done my settings in 3 modes: ear, nose and throat. So whichever I want, with a button press you can keep changing that. Though the MI team has not proposed this to be used in OT, but I have done certain daycare procedure and small surgical procedure with this, and there was absolutely no hindrance. So if you have the facility, you can do myringotomy, grommet insertion or coblation turbinoplasty. It gives wonderful clarity for small surgeries as well. So I finished the whole adenoidectomy procedure with the camera, and it went really well. We did the tympanotomy grommet also. The clarity was wonderful both in ear and nose. I'm not saying that you can do all the surgeries with this camera, but definitely the small procedure which is going to finish within half an hour, 40 minutes, and there is no chance of heavy bleeding, easy simple procedures can be very well be done with this thing.